Usually when patients complain about their bite being in the wrong position, they're a pretty good indication of what's right and what's wrong. And anytime you're dealing with, entire arches, if you get the wrong interocclusal registration or the lab, builds things that aren't the way you want them, a lot of times maybe the bite is off. And some people can adapt to almost anything. Some patients, are very keen on, their bite and I call it really have an acute occlusal awareness. But I think the bottom line is if you can use quick splints and to relax the muscles so you can manipulate the mandible, then you can go ahead and adjust the occlusion so you have a good, stable, centric occlusion. And then the other part of that is just to get good anterior guidance so the anterior teeth separate the posterior teeth when you go into excursions. And so, I don't think occlusion's all that complicated. So if you can get the muscles relaxed, so you can manipulate the mandible, develop a good, stable, centric occlusion with good anterior guidance, and virtually every patient will adapt to that nicely. And the QuickSplint can be very helpful in getting patients relaxed so you can manipulate the mandible. I call it mandibular control.
Most people don't really understand muscle physiology. Most movement around joints require agonist-antagonist muscle interaction. If I want to bend my arm, my tricep has to extend, it has to relax slightly, and my bicep has to contract more. Well, when it comes to the TM joint, the elevator muscle and the opening muscle, which is the lateral pterygoid, don't have that relationship. And that's because the lateral pterygoid has very few stretch muscle reflex receptors. So most AP slides occur on the posterior as patients have to move from CR, CO first contact, into MIP. Now, this causes the lateral pterygoid to contract and bring the jaw forward. By using a quick splint and eliminating those posterior interferences, now the lateral pterygoid can relax and go back to its most comfortable optimal position, and this allows us to establish the occlusion. Once we establish the occlusion, then we can make our patients comfortable in their implant provisionals, and then as we transition them to definitive restorations, everything works out really well and everyone's happy.
Hi, Mike Smith from Biting Education and Clinical Mastery Series. The question is, why do patients say that their implant temporaries are putting their jaw in the wrong position, and how does QuickSplint help the patient transition to a new occlusion? Well, as you have inflammation, the bite changes. As they have a foreign material in their mouth, they can hit it weird. They can hit it and they can make parafunction on it. Well, what the QuickSplint does is helps to alleviate that inflammation, allow their neural response, their proprioceptive response to change to allow them to redevelop new engrams to protect their bite, protect their jaw, and get it so their occlusion can settle back in the best manner. So QuickSplint really helps from the inflammatory standpoint to get it so they can alleviate those symptoms and get it so they can get their bite right as quick as possible.